When reflecting on various groups of people that are typically othered by the healthcare system and healthcare providers, I chose to go with individuals who are overweight and obese. Personally, a bias that I've recognized towards this group of people is that in general they don't care about their well-being and that they can easily make lifestyle changes in order to be healthy. I think this stems from my personal experiences with health and wellness and exercise. My educational background is in nutrition and dietetics, so I do have a pretty good understanding of having or living a healthy lifestyle and ways to prevent chronic diseases. I also was always active as a child with sports, and growing up, I just became more passionate about exercise and eating healthy. I'm not the epitome of health and wellness by any means, but it's something that I've always felt that was something important to care about when it comes to everyday living. What I have witnessed in clinical experiences as a student is that sometimes a patient is not being taken seriously because it's assumed that they do not care about their health. They are not prioritized appropriately, and they are typically blamed for making choices that have led to their obesity. There is usually a lack of accurate assessment as well as to the underlying reasons, such as other diseases, mental illness, or cultural factors that impact their outcomes. When looking at the Crosscarry article, type 1 thinking is more intuitive, which can lead to the development of biases, while type 2 thinking is more of the analytical side, which can result in clinical judgment errors. When talking about the two together, the development of biases with type 1 thinking can misdirect diagnostic reasoning from type 2 thinking, and that is what leads to the clinical error, as well as grouping individuals in the other category. When patients have these negative experiences in the healthcare system, it can lead to avoidance of care, stress, and mistrust of healthcare professionals. People in these groups are not receiving equal care, and as mentioned in the BA article, avoidance of care that evolves from marginalization of groups leads to a bigger gap in access to healthcare and resources. This results in the creation of physical, emotional, and psychological boundaries for patients, ultimately leading to poor patient outcomes. It also allows for biases to continue to develop and doesn't really address the underlying issue. And it can also induce care and fatigue for healthcare providers. When talking about the healthcare system and the obesity population, there needs to be increased access to healthy foods within geographic areas, increased access to education related to nutrition and activity, and elimination of food deserts. Healthcare providers have the ability to advocate for these changes, and they can also act as a voice for this population in order to improve all of these. Training of healthcare providers should start with recognition of biases within various groups of people that are usually marginalized, which could be done with state case studies. So, having a patient presenting with a certain illness that, or really any background that would lead to a bias, and allowing the healthcare provider to step by step go through what they think is going on with this patient. And in doing so, they would be talking about any biases that come up, and recognizing them would be helpful in understanding why they are being developed, and can also help reduce biases from occurring. I believe using a mindful approach and forcing strategies, as mentioned in the Crosscarry article, could be helpful in suppressing impulsivity, and inducing cognitive debiasing in clinical decision making. Implementing assessment checklists specific to different marginalized groups could also be helpful in mitigating biases and really getting to the root cause of the individual's problem. For example, in the obesity group, an assessment could include questions related to childhood experiences and attitudes and beliefs related to nutrition and activity. This would provide a more patient-centered approach to the assessment and can help providers gain a better understanding of the patient. And it also will allow for improved patient-provider relationships through trust building. And I think overall, this type of training would help these individuals in marginalized groups experience quality and equal healthcare.